Hello, my name is Trevor Davis, and I am the administrator at Louisville East Post-Acute in Louisville, Kentucky. We are a 178-bed skilled nursing facility with a 28-unit traumatic brain injury unit, as well as a 28-unit memory care unit, which is a locked, secure unit for dementia and Alzheimer's residents. So I'm going to talk a little bit about post-acute care and how it differentiates for different lines of service within this sector, and also talk about the different disciplines and what a day in the life of a resident that resides in a skilled nursing facility. So to start off, post-acute care, I'm sure you all are familiar, but there are different lines of service. There's independent living, assisted living, and skilled nursing. So independent living, those residents that reside there are lower acuity. They can tend to do most everything for themselves, but they're entering independent living space, so they don't have to mow their lawn. They can have meals prepared for them. Just eases the burden on routine daily activities such as shopping and housework. So those are 65, 70-year-olds that still go out once a week to play tennis, go golf. They can come back to their units and have a meal prepared for them, have housekeeping services prepared, taken care of for them. Assisted living is the next line of service. So those residents need a little bit more help. So caregivers in that sector, they will do the laundry, they'll serve 3 meals a day as well as snacks. They'll do some light caregiving activities, so occasional transfers and assistance with those activities. However, they do not regularly change briefs, administer medications, and that kind of thing. So in an assisted living, the administrator of the assisted living still has medications locked up, but the residents should still be of sound enough mind to be able to take their medications with a little help. Another sector is really personal care. I didn't mention that before, but personal care is really in between independent living and assisted living. And then you get to skilled nursing facilities, which provide skilled nursing care. So the Centers for Medicare and Medicaid defines skilled services as tracheostomy care, physical, occupational, and speech therapies, other nursing care related to ventilation, wound treatment. So for residents to come here, they must need some of those services. So we get residents here that they might have fallen at home and had a hip fracture, and they need to come get rehab for 2 to 3 weeks and go back home. And then we also have residents that need long-term care, meaning they move in here and they are going to live out the rest of their lives here. So to differentiate those two patients a little bit more, the residents coming in for rehab, we typically cohort them on a specific unit that has other residents that are here rehabbing. So they get therapy services at least 5 days a week, and those are typical of physical therapy, occupational therapy, as well as speech therapy. The residents that are here long-term are on usually the long-term care units. So those residents, they don't have the family support at home to care for them 24/7, so they utilize our nursing staff. So nursing staff provide those residents directly their medications 2, 3, 4 times a day. We cook their meals and give them snacks 3 times a day for meals and 3 snacks a day. And all of that's monitored by a certified dietary manager, as well as a registered dietitian. In addition to that, they have activities. We have clergy come in. We have a chapel here. So, things they enjoy that they enjoyed earlier in their life, we still identify those things and have activity staff, social
100
workers.
hall nurse line 1, please. 100 hall nurse line 1, please.
We have them help assist those residents so they can still live a fulfilling life. We have residents that are here long term that, they'll go out on fishing trips, they'll go to the mall, go to Churchill Downs. So they still do fun and exciting things. They still have lives. They just need a little bit extra help. We have a traumatic brain injury unit. So that unit typically receives younger patients related to drug overdoses, car accidents, those type of things. And that is a really highly regimented therapy service. Those therapists and counselors are specifically trained for traumatic brain injury units, CVAs, strokes. So we serve, a specific population on that unit as well. And then we work with some home health agencies and other agencies to try to get those younger residents, back out into the community. So they usually transition to group homes with companies like Neuro Restorative, so they can get back, to their community and live their life to the fullest. So that's a little bit about the different residents we serve. One last, I didn't mention the memory care unit. So you all know Alzheimer's and dementia is a very hot topic in healthcare right now, especially as the generations age and we're seeing more and more patients with those diagnoses. So the memory care unit is a locked unit. It is built for residents to be able to wander the hallways, the dining room, and the activity room. And we have shadow boxes outside of each of their doors so they can try to identify their rooms better. Because with Alzheimer's and dementia, your memory, most of their memories, they still remember things earlier on in life. So high school, college, their wedding. So again, those staff are trained specifically to deal with residents with Alzheimer's and dementia. And then we have specific activities that is best for that population. So now I'll go into and touch a little bit on the different workers that work within this skilled nursing facility. So I understand this class is comprised of various disciplines in the healthcare field. So long-term care is a great field right now, especially as it is growing very quickly. And any healthcare worker has a spot in this field. So as far as therapy goes, of course, we have physical, occupational, and speech therapists on staff. And they're working with residents that come in for short-term needs. They're working with residents on the TBI unit, the traumatic brain injury unit. And they're also working on needs of our long-term care residents. So even long-term care residents might decline in a 6-month period of time and need an occupational therapist to work with them to improve, maybe contractures in their hands, or maybe their ability to toilet themselves has decreased after they had an acute illness. So therapists don't only treat those coming in for quick rehab stays, but they also treat, the 100 other patients that we have here long term to keep them functioning to their best capability. So those are the therapists. Of course, we have a medical director who's a medical doctor. So his responsibility is for overseeing medical policies and the medical care of this building. And then we have a number of attending physicians that round regularly with their residents. And then each of those medical doctors and attending physicians have either PAs or nurse practitioners that they utilize for more frequent rounding. So we might have the attending physician come in once a week for one of our contracted physician groups. However, their nurse practitioners or their PAs are in here 3, 4, 5 days a week making rounds. And so what they're doing is, they're going to see any residents that have acute issues, especially our rehab residents. They're making sure that they are stable and not at risk for rehospitalization. We also utilize podiatry, dental, ophthalmology, and optometry. So we have contracted services for those various groups, and they come in usually a few times a month to provide services to our population. So typically nursing facilities, skilled nursing facilities contract with vendors that hire those 4 disciplines, and they make rounds on facilities. Same thing, independent living and assisted living. Those disciplines round, they usually go to resident rooms, they go to the facility and set up shop in a specific area, and then see several patients in a day. So obviously we have certified nurse aides. Those are the frontline workers that help with activities of daily living. We have licensed practical nurses, as well as registered nurses, all on staff. So that's the bulk of our staff. And then other staff, we have dietary aides, registered dietitians. I don't know if there's any registered dietitians in this class, but we utilize a registered dietitian full time, and they really keep up with residents that are on NG tubes or any enteral feedings. So they make sure the caloric intake is stable for those residents, as well as managing our menu with our dietary vendor on a regular basis to make sure we're meeting the Food Drug Administration's nutritional guidelines. So that is a very important role. Nutrition in the elder population is critical to fight disease, to heal wounds, to recover more quickly. So nutrition is a key part of what we do here. So I'm unable to do a facility tour, but I did kind of want to talk about the layout of the building, and then I will send some pictures so you all can kind of piece together what the facility looks like. And most skilled nursing facilities are the same. So this facility has 2 different rehab gyms. One rehab gym is approximately 800 square feet, and so it's got different rehab equipment, parallel bars, Barrehab table, New Step, things like that the therapists use. It also has a full kitchen as well as a washer and dryer. I know when I first got to the industry, I went into a therapy gym and asked, why is there a kitchen? Why is there a washer and dryer? So occupational therapy, of course, before we send residents back home, if someone's coming to us and before their hospital stay, they were cooking and cleaning and doing their laundry on their own, and maybe they had a fall with fracture, well, we want to make sure they can still, do those things that they did at home safely. So a lot of times residents will come down to the therapy gym to participate in therapy services. Sometimes our therapists will go to resident rooms to help those residents. They might need to be doing something specific like a toilet transfer or a bed transfer that can be done in a resident's room. So there's a lot of activity. We usually have 50 of 170 patients on therapy caseload at any given time, excluding the traumatic brain injury unit. So it's a busy place. The traumatic brain injury unit has, another 600 square foot therapy gym back there. And it's built a little bit differently to meet the needs of that patient population. And everyone back on the traumatic brain injury unit is receiving therapy, 5, 6, 7 days a week. So resident rooms are either semi-private rooms or private rooms. So a semi-private room, they're 160 square feet, 200 square feet. They have privacy